Well, here in the mid-state, many educators have already been teaching in person. A new report says 1 in 4 teachers is at risk for COVID-19 complications. News 4's Alexandria Adams went digging to find out who's most at risk and what steps are needed for protection.
When it comes to COVID-19, we really do see that there are certain risk groups that tend to do poorly with the infection. They tend to be overrepresented in the patients who are in the hospital and unfortunately overrepresented in the patients who succumb to infection.
Those groups he's referring to are those who are 65 years or older or have underlying health conditions.
People with medical conditions that are pretty common in adults, like high blood pressure or diabetes or being obese. And so I think it's important for us to understand that adults, and in particularly adults with chronic illness and older adults over 65, are at risk.
According to the report released by the Kaiser Family Foundation, a nonprofit that focuses on national health issues, nearly 1.5 million educators fall in those groups and are at risk for potential COVID-19 complications.
As we start to see more schools open and more people getting together, if the disease activity is still pretty active in the community, we definitely need to be prepared that people in these risk groups are going to get infected and may end up at the hospital.
If an educator is under an increased risk, they may be protected under the Americans with Disabilities Act to be eligible for accommodations. That person must show a connection between the impairment and the specific need for accommodation. As for age, the CDC does acknowledge being older does put you more at risk for complications from COVID. But in general, someone would not qualify for accommodations just based on age. Reporting for News 4 Nashville, I'm Alexandria Adams.